On today's talk, we'll have a brief discussion on whether it is possible or not to downgrade a healing pressure injury, i.e., if you have a stage 4 pressure injury, as it heals and fills with granulation tissue, can you downgrade it to stage 3 and then stage 2? This seems to be an element of clinical confusion, with some practitioners downgrading it and others refuse to do so. We'll explore this question with reference to basic concepts. First, let's look at anatomy of the soft tissues covering the skeletal system, the body skeleton. The skin is composed of two layers. The outer layer is the epidermis. Then the deeper the inner layer is the dermis. So the first layer of soft tissue is the epidermis. The second layer is the dermis. Underneath the thicker dermis is the subcutaneous layer, the fat layer. So you can see here on my left, as I'm looking at the screen, the epidermis, layer number 1, layer number 2 is the dermis, layer number 3 is the fatty layer, the subcutaneous layer. Now, in most parts of the body, underneath the fatty layer, the fourth layer tends to be the muscle layer, like for example on the arms and the legs. Underneath the fat is the muscle. That's the fourth layer. Some other parts of the body, for example the heel, underneath the fat pad you will not find any muscle. You'll find the tendocalcaneus, the calcaneus tendon, or the plantar fascia. So there is minor variation in the soft tissue layers depending on the part of the body that one is focusing on. However, it does not change our pressure injury staging, which we'll very briefly discuss now. I previously discussed pressure injury staging, and I'll add a link to it in the show notes. So, what's stage 1? Stage 1 pressure injury is limited to, visually at least, limited to the outermost layer of the soft tissue, which, as we discussed, is the epidermis. And underneath the epidermis is the dermis. So stage 2 pressure injury is an injury that extends into the dermis. In stage 1 is a non-blanchable erythema. There's no ulcer. Stage 2, you have an ulcer that extends into the dermis, but the dermis is not totally obliterated. When the dermis is totally obliterated by injury, and one can see the third layer, the subcutaneous layer, the fatty layer, then one has stage 3 pressure injury. Now, stage 4 is anything below the fatty layer. So if the third layer is obliterated, then one extends into the fourth layer, which over most parts of the body tends to be muscle. However, as we discussed, there are areas of the body where there is no muscle, and you may find fascia or tendon or other tissues. So stage 4 is extension below the fatty layer. Any tissue below the fatty layer, if that is involved, then you have stage 4 pressure injury. That tissue may be muscle, maybe fascia, maybe cartilage, maybe bone. So stage 1, limited to the epidermis. There's no ulcer, just non-blanchable erythema. Stage 2, you have an ulcer now. Extends into the dermis, but the dermis is still visible. Stage 3, you have an ulcer which totally obliterates the dermis and extends into the fat, and the fat is visible and not totally destroyed. Stage 4, the fatty layer is totally obliterated, and then the layers of the tissue underneath the fat are visible, and that's stage 4 pressure injury. Now, one of the things you'll realize from our discussion is that this classification is anatomical classification. Stage 1 is related to involvement of the epidermis. Stage 2 is related to the involvement of the dermis. Stage 3 to the involvement of the subcutaneous layer. It's an anatomical classification. Nowhere in that classification we discuss absolute depth. That's not important. Now, in clinical practice, it's important to take note of this because the soft tissue thickness varies. So let me give you an example. Over the eyelid, your dermis is about 0.3 millimeters thick, 300 micrometers thick. But on the back, the dermis is 10 times thicker, 3 millimeters thick. What does that mean? Your stage 2 pressure injury on the eyelid will be 10 times shallower in general, up to 10 times shallower in general than a stage 2 pressure injury in the back. A deep ulcer, a relatively deep ulcer on the back can still be stage 2 because it only involves the dermis. So now, to the contrary, you can have a very shallow stage 4. So either you can have a deep stage 2, as we discussed on the back, or you can have a shallow stage 4 pressure injury, like on the ears, the nose, or the coccyx. On the ear, you have the epidermis, the dermis, very little fat, and then below the fat, you have the cartilage. And as we discussed, any tissue below the fatty layer, if that's involved, then you have stage 4 pressure injury. So on the ear, if you have a pressure injury, the ulcer may only be 2 millimeters thick and is stage 4, whereas a 2 millimeter thick ulcer on the back is only stage 2. Same goes for a pressure injury on the bridge of the nose due to medical related devices, for example. And a common mistake one notes in clinical practice is a pressure injury on the coccyx. It's not uncommon that there's an injury about 2 to 3 millimeters deep and is labeled as stage 2, when in fact it extends down to the fascia. So relatively shallow pressure injury on the coccyx can be stage 4 because pressure injury is classified based on the tissue type involved, not on the absolute depth. The absolute depth of different tissue layers varies according to different parts of the body, as we discussed. So when you are staging pressure injuries, one must be aware of this. Otherwise, as we all know, there can be repercussions. Previously, we spoke about different phases of wound healing, and I'll add a link to that presentation in the show notes. Briefly, there are 4 phases: the phase of hemostasis, followed by the inflammatory phase, the second phase, the third phase, the proliferative phase, and the fourth phase is the phase of remodeling. In the inflammatory phase, the wound cavity is cleaned of debris, bacteria, necrotic tissue, and once the cavity is clean, the wound enters the third phase, the proliferative phase, during which new tissue is formed to replace the damaged tissue. And once the proliferative phase is completed, then there's remodeling. Although there is a substantial overlap between these phases, especially the second phase, the inflammatory phase, and the proliferative phase, and to some extent the fourth phase, the remodeling. So we will now focus on the proliferative phase of wound healing, the third phase of wound healing, when new tissue is being formed. Now let's take an example. Let's say we have a wound on the back of the leg, as you can see here in one of the pictures, the top right picture. This is a stage 4. Let's assume that this is a stage 4 pressure injury. The stage 4 pressure injury has damaged and destroyed the epidermis, the dermis, the subcutaneous layer, the fat layer, and also partially damaged the muscle layer, the fourth layer, the calf muscle. As the wound is healing, these damaged tissues are now replaced by a healing tissue. Now, what is this healing tissue? Well, this healing tissue is the granulation tissue. And the granulation tissue has two components. Number one, the extracellular matrix, and number two, the cells. Now let's talk about the extracellular matrix. The extracellular matrix is collagen, fibronectin, embedded in other extracellular components such as glycosaminoglycans, which are large macromolecules made out of carbohydrate chains, and proteoglycans, which are macromolecules with a central protein core with branching chains of carbohydrates. So this extracellular matrix, together with the cells, the fibroblasts, the endothelial cells, which are sprouting off the capillaries from edges of the wound into the wound cavity, forming miniature blood vessels, and the myofibroblasts, which help in wound contraction. So these cells and the extracellular components make up what we call the granulation tissue. This is the healthy, healing, red, shining, compact tissue that one sees in a healing wound, as depicted here on the three different wounds. That's the granulation tissue. So our original tissue, the epidermis, the dermis, the fatty layer, and part of the muscle has now been replaced with the granulation tissue. And if you look at this diagram here on my left, here is a depiction of a wound that extends all the way from the epidermis down into the fatty layer. And on my right, you can see the wound extending down into the muscle layer. So we've taken these tissues, these damaged tissues, muscle, fat, and dermis, and replaced them with granulation tissue, scar tissue. And the key thing to note is that this granulation tissue is the same for all levels. So whether it's muscle, or the fatty layer, or the dermis, it's the same granulation tissue. Prior to this, the different layers had a distinctive function. So the dermis has its own function, the fat has its own function, and the muscle has its own function. Now is replaced by a near homogeneous tissue, the granulation tissue or the scar tissue when the wound is completely healed. So the take-home message is that the original tissues are not regenerated. Your muscle is not regenerated. The fat is not regenerated. The dermis is not regenerated. That means the original function has not been restored, because the new tissue is essentially collagen fibers embedded in this extracellular matrix, which we call scar tissue. So okay, now the wound cavity has been filled with granulation tissue. Why can't we downgrade it? If you look at the two pictures here, the top one is healing stage 2, pressure injury on the heel. The bottom picture is a healing stage 4 pressure injury on the sacrum. They're of almost the similar depth. They look the same overall, covered with a reddish tissue at the base of the wound, but there's a difference. The stage 4 pressure injury on the sacrum, which prior to healing extended all the way down to about 2.5 centimeters, is now only a couple of millimeters deep, is not the same as the stage 2 pressure injury on the heel, which is about 1 to 2 millimeters deep and is healing now. Why? Look at the base of the wound. The base of the heel, the layer of soft tissue is the dermis. It's a functional layer. It's the dermis. On the healing stage 4, we haven't regenerated the dermis, so we can't say it's equivalent to stage 2. We haven't regenerated the fatty layer, so we can't say it's equivalent to stage 3. The first functional pre-injury tissue on stage 4 will be below the fatty layer, and that functional tissue could be muscle, fascia, ligaments, but it has to be below the fatty layer. In stage 4, we have not regenerated the fat, we have not regenerated the dermis. And in some cases, as we already discussed, on the calf, the stage 4 extended into the muscle, we have not regenerated the muscle tissue. We've replaced previous tissues with distinctive function. The dermis has its own function, the subcutaneous layer has its own function, the muscle has its own function. We replaced all these tissues with a single layer of near homogeneous granulation tissue, which is visible in a healed wound as a scar tissue. So we haven't regenerated those tissues. And that's why you cannot downgrade pressure injury, because you have not restored anatomy, you have not restored function related to the damaged tissue type. All you've done is you've placed those damaged tissues with granulation tissue or the scar tissue on a healed wound. So the verdict is, one cannot downgrade a pressure injury, because through the healing process, function has not been restored, anatomy has not been restored. Important to note that pressure injury is not related to the absolute depth of the pressure injury, but it's an anatomical classification. So I hope you like this presentation. If so, give it a thumbs up, subscribe to the channel. Take care. See you soon. Bye for now.